Okay, good afternoon, everyone. Welcome, and welcome to those of you who are joining us online. I think we have about 20 people or so online so far. Numbers are increasing. It's a great turnout here. My name is James Ford. I'm a professor at the Priestley Centre for Climate Futures. It's my pleasure to moderate today for the lecture by the Piers Sellers Prize winner, just Dr. Carol Zavaleta. So the way things are going to work is I'll just give a quick intro to start things off to both the award and to Carol. We'll then spend most of the time with Carol presenting, and there'll be time for questions and answers at the end. Then afterwards, we have coffee and drinks in the foyer outside. So firstly, the Piers Sellers Prize. We've been offering this prize each year now since 2016, and it's in recognition of Piers Sellers, who was a former alumnus of Leeds, with his PhD, graduating in 1981 here at Leeds. He then moved to the US, where he was based at NASA for most of his career, where he directed the Earth Sciences Division. He was also an astronaut and spent a lot of time in space, I think about 35 days in space. Sadly, he passed away in 2016. But since that time, we've offered 2 awards each year in recognition of Piers Sellers. One is the award for outstanding PhD research, and also another award for outstanding contributions to understanding and responding to climate change. And that's why Carol is here today. So Carol is a Peruvian Quechua researcher based at Cayetano University in Lima. She was trained as a medical doctor and practiced in the Amazon for many years. She then did a PhD at McGill University in Montreal, and for a PhD moved more towards health geography. She was looking at the vulnerability and resilience of indigenous communities in the Amazon to climate change. And that's remained a central feature really of Carol's work since that time. She's working with communities on the ground in the Amazon, trying to understand how climate change affects health and well-being. And as part of the selection committee, that was one of the things that the committee really liked about Carol's work and the nomination for this prize is her contribution to climate solutions, working with communities that are on the front lines of climate change. After she finished her PhD, she did a Wellcome Trust Fellowship, and she's received a number of awards for her work. The Piers Sellers Award. She was also named recently by the Forbes magazine as one of the 50 most powerful women in Peru. It's a pretty cool recognition. And she's also received the Order of Cayetano, which is a recognition by her university for her outstanding contributions in the field of indigenous people's health. In fact, at her university, she established the first ever unit focusing on indigenous peoples and health. Sorry, let me say that again. The first ever unit focused on climate change and indigenous people's health in Peru, most likely even in Latin America at large. So, Carol, welcome. I've got a little plaque here to give to you.
Okay, thank you, James, and thank you very much for the opportunity for these minutes, and also for this plaque, for this recognition, right? So about the work that we are doing on the ground, and especially for my colleagues, indigenous researchers who are in Peru and also in Bolivia, and also thinking on that, I brought this for you for the Priestley Center for Climate Futures, because this is a weaving. This is very traditional in the Andean communities in Peru and in Bolivia and Ecuador, because weaving is a way how your mind transform things that you want to transmit, and it's particularly this is related with the Titicaca Lake, which is where you see animals like dogs, like condors, and also fish, right? So I brought this because I think the weaving that we are trying to do with research, with science, and with indigenous knowledge, it's being reinforced by the work that the University of Leeds is doing and in supporting the research with indigenous communities, not only in Peru and Bolivia, but around the world. And I think that that's important if we want to face and adapt climate change, which is a global threat, especially for human health, and particularly for indigenous communities. So please keep this with you just as a remembered thing that we are making these connections across the globe.
Thank you, Carol.
Okay.
I'll pass this out. It's a really beautiful piece of work. So I'll pass it around so you can all see it. Just as long as it gets back to me at the end. So Carol, over to you.
Okay, so I wrote my notes because when I get nervous, I forget the things. And okay, so first, thank you so much for the opportunity to speak at your university, and thank you to the Yorkshire region for allowing me to be here in this land and to allow me to transmit this information to you here and also to the people who are following online. I want to start by talking about the challenge that calls us today, climate change and the impacts of indigenous communities' health. We already know that our planet is getting warmer across all countries, but my work is specifically focused on indigenous communities in the Amazon. Unusual extreme events are one of the key manifestations of global warming in that territory, and showing how the climate crisis is affecting the lives of indigenous people. This graphic was created during a workshop held in the territory of the Shawi indigenous population in the Peruvian Amazon in 2023. Community members marked the years where they experienced changes in weather conditions that impacted their ability to obtain and produce food. So in this picture, I wanted to show two major events that they are experiencing recently, major floods and strong winds. So in blue, you can see 3 major floods, and in the orange, you can see the strong winds. Normally, when you think in the Amazon, when you review the evidence and the projections, you thought about the drought. That is also about changes in seasonality. So how the drought season is getting more longer, and also how the Amazon is getting more drought. But also I want to mention that for indigenous communities, the variety of impacts is different, right? So the impact could be and depends on where they are located and how and what the type of lives they are using or living. So on the first day of the workshop, we asked them to remember a major flood and reflected on that experience. Both men and women shared the following related on how an extreme event flooding was feeling in 2008. There was a flood that reached up to 2 meters high in some places of the community. It happened at night after 3 days of rain. By nighttime, the flood water came, it covered all their crops, houses, and affected their animals like chickens, pigs, and dogs. They lost their cooking pots, their pans, their plates, everything they owned. The house was filled with mud, which dried after a week. The water was not safe to drink because it stayed muddy, so they had to get water from a nearby stream, but they needed to walk a long distance. The fish died in the closed stream, and their banana and cassava crops were completely covered. Only after a week, the crops began to dry up and rot, and the mud stayed on the fields. It took 1 year for them to recover their crops. During that year, they borrowed food from their relatives. Immediately after the flood, what they ate wild food like cocona, mushrooms, macambo, breadfruit, chonta palm, suri worms, and fish from the closed creeks. A week later, they started cleaning out the mud, but they didn't even have firewood to cook. When the cassava was covered, the woman cried because the crops were ruined, and women are the main people who plant cassava. And they had no food. They say all our work was for nothing. We lost our work, and it was a year of hunger. They started making new fields, but eat and drink was very complicated and difficult. No institutions came to help them at that moment. As a response to that threat and that challenge, people who had been farming on the lowlands and who were affected mostly for the flooding began to make their fields at higher altitudes, giving them two options for producing foods. One close to the rivers because the soil is better when you have all these materials, but other alternative closest to the mountains in the higher places where they can prepare for future floods. They also began to plant more resilient crops that could survive much extreme conditions. In these pictures, in column A, you can see community members who took pictures of crops where they affected by strong winds. This is what you see, the crops are fall down. In column B, you see a technique that they are used to prevent fruit trees from falling. So you see the arrow there that is getting, that is putting up the banana. So that's to prevent the strong winds to destroy the banana. And also you can see in the bottom that they start to use a species of tree that is resistant to flooding. I only want to mention this part because, I want to mention this part because I think it's important to know how the people are living these extreme events. A part of the changes in season that the Amazon is experiencing, these specific impacts are affecting women and men who are living in these communities. In parallel, the past year, I also learned about the Chacaltaya mountain in Bolivia. It was used to be a ski resort in La Paz, Bolivia, and normally now it still is an apu, it's a mountain that is appreciated by the local population in La Paz. There was once, 15 years ago, it was still a glacier, but now there's no more ice there. So this glacier completely melted, and how this glacier is melted is a similar situation that is happening in the Andes in Peru and other mountains in Bolivia. So the consequences of the climate crisis is already feeling in those mountains, and the people they already realize what is happening. And for example, for this particular ski resort, what I was wondering when I knew about this story is that it disappeared in 2009, so many years ago, and nobody saw anything. So I was thinking that why nobody was paying attention to this huge change in the mountains. So for the past 20 years, I have been working with indigenous communities, mostly in the Amazon. My journey has evolved from being a primary care medical doctor to becoming a researcher, and now to advocate for the direct participation of indigenous peoples in policymaking. I call this morning Thinking in Circles, this journey Thinking in Circles, because I have navigated from being an outsider to becoming an insider and back again. This is because at the beginning of my journey, despite being Peruvian, educated in Peru, and living most of my life in my country, I was still an outsider to indigenous communities. That position made me want to become a researcher to better understand what was happening in those contexts and how to improve the health of indigenous populations. Because as a physician, I realized and discovered that the health conditions of indigenous populations was worse compared with populations who were not indigenous. Why do indigenous communities struggle to access the quality of health services they deserve? One thing that I learned is that indigenous people in Peru and across the world have experienced multiple forms of exclusion over centuries. This includes colonization, land disposition, labor exploitation, and the imposition of educational, health, agriculture, and other systems that were not part of their own places and practices. I also have learned that global society has forced indigenous communities to change, but many of their core values, ways of life, and ways of thinking remain alive within indigenous communities around the world. In these pictures, you can see part of our work in Peru and also in Uganda, where an artist took images of the main characteristics of the food systems among the Shawi and also among the Batwa communities. One way indigenous peoples have coped with the pressures pushing them away from their culture has been by adapting to urban and peri-urban environments, where they can access better services such as health and education. However, in doing so, many have felt the need to hide their identities to fit into the larger society. For instance, Quechua speakers in my country, who often face stigma and prejudice in the Peruvian society, choose to conceal their linguistic roots and learn Spanish instead of Quechua. This is also driven by the fact that national services in many countries like mine are not adapted to promote indigenous identity within public services. As seen in this table, the indigenous population in Peru has increased in urban places. So you can see here in the top how the urban Quechua, urban Aymara, and urban Amazon are increases, while the rural Quechua, the rural Aymara, and the rural Amazon has decreasing, which unfortunately puts them at greater risk for various health conditions now prevalent in urban and peri-urban areas, like chronic health diseases as diabetes. The knowledge of how indigenous peoples in my country face multiple cultural and social changes, combined with the experiences of my patients and participants in my climate change studies, made me realize that these struggles were also faced by my own family. My grandparents were originally Quechua. They lived originally in Huaraz and in the Andes of La Libertad in Peru, but they changed and stopped passing the other language when they emigrated to the coast. The complex changes that families like mine experience sparked my concern about the importance of access to good health, good education, including learning English, to create opportunities for indigenous populations. But in this pathway, learning about other cultures while maintaining their own identity is crucial if we want to increase the participation of indigenous peoples in leadership positions. One way to achieve this is through intercultural approaches, such as co-creation of knowledge, where diverse knowledge systems come together in a respectful and safe space, allowing for the emergence of new knowledge, innovation, and the values to combine. My work in this picture, this picture was taken in Canada while I was doing my PhD. And what I want to show you here is that when I was in Canada, I discovered there were more indigenous peoples in other parts of the world. And it also inspired my work to continue doing different things when I come back to my country. My work, as well as my family experience, made me realize the importance of creating policies and local initiatives that preserve indigenous knowledge and values, while fostering collaboration across disciplines and international, especially when adapting to climate change and increasing resilience to other global crises like pandemics. Solutions cannot be created solely in the global north, nor exclusively in the global south. Indigenous philosophies, such as the principles of reciprocity and care for Mother Nature, can be embedded in these collaborations. The magnitude and speed of the climate crisis, impacting all aspects of our health and well-being, call for collaborative efforts. In these efforts, insiders and outsiders, including researchers, funding agencies, policymakers, community members, work together, and this collaboration helps balance the strengths and weaknesses of multiple positions and can lead to more equitable and effective solutions and outcomes. This is the work that we are doing currently in Peru, creating a dialogue to support health systems actors in collaborating with indigenous communities. So in this picture, you can see our work at the regional level in the picture in the top, where one of the indigenous leaders were recognized in Peru is teaching a class to the health workers about how is the health system in indigenous communities. In the bottom is a meeting that we have with the authorities at the national level with the health sector, and also in the left, you can see just my participation in a meeting where we are talking about new challenges for funding climate change and health research. However, to avoid repeating injustices, Indigenous people's priorities, visions, and leadership need to be at the core of objectives, methods, and results dissemination of these collaborations. As we aim to implement adaptation, mitigation, and increase the resilience of health systems, our collaborative work must rebuild trust in science and policymaking. This process begins by recognizing power imbalances in global policy relationships and imagining new solutions by working with people who have been excluded in the past for centuries. Additionally, existing international principles such as free, prior, and informed consent and international legal frameworks protecting Indigenous rights must be included and respected. In this point is where I see the importance of cultural humility, especially among those with the privilege of high-level mainstream education, and the importance of mentor the next generation of Indigenous researchers to accelerate the involvement of Indigenous peoples in key climate change responses and global discussions. These three pictures are taken in the Shawi community where I was working with. And the first one, you can see one of the Santusa, which is one of my friends. She's an Indigenous, now she is an Indigenous businesswoman. She wants to create an enterprise based on their own weaving materials with jewelries and also with the clothes. In the middle, this is a youth. He wants to be a nurse. And he is showing one of the plants that they have in the home garden. And this is an approach that someday we can see that the healthcare services is using plants to prevent diseases. And in this way, you also can reduce the use of waste materials in the healthcare sector. And finally, in the last picture, is about, it's a PNU, it's an Indigenous elder who is also proud of teaching to his grandson who wants to know about the specific words and secret celebrations that they use to ask for permission and to give thank you to the mountains. So I appreciate you taking the time to learn about my work, but also to learn about the people who I am working with. And to moving forward, I would like to see that actually the climate change research and climate change policy is paying more attention to the impacts on health, but around the world, but specifically the impacts of climate change on Indigenous communities, Indigenous populations, not only in rural places where we can imagine, but also in urban places where also there are Indigenous communities. And that's it. So thank you very much. We have questions and answers now. Many thanks.
Someone able to do the lights in this room? It's not over there.
The population graph, it looked like you're actually losing population overall. It's not just urbanizing, but it looks like the totals have reduced completely out of the catchment. Is that right?
It depends because the sources are from different census. So we don't have, our last census was in 2017. So what is happening is that self-recognition probably is also decreasing. So this is why you don't see a reflection of the same numbers, not either the increase of the self-recognition of being Indigenous. So that's also part of the context. I think in Latin America, not only in Peru. Yes.
Repeat the question when you asked. So it's all online, can you hear the question?
Okay, so yeah, thank you. Yeah, no, thank you. Sorry, yeah, I didn't realize. Yeah, the question was about what happened in the table because it seems that the population was, oh, sorry. I think that I accidentally, yeah, sorry, yeah, here, my skills on Zoom come back, okay, thank you. Yeah, okay, so here, yeah, what the question was, that seems that the population was decreasing in general, but I am So my hypothesis is that this is because people are reducing their self-identification as an indigenous person. Actually, I can comment on that because I think it's important. When I was speaking with the people in the urban places who has an indigenous background, they also told me that one rationale for don't say that I am indigenous is because they don't want to take the advantage of being indigenous if you are in urban places compared with the people who really need it in the rural places. So there is also a logic behind says that you are or not indigenous in urban places. Yep. Another question?
Since you talk about cities, thanks for the super interesting talk. And this picture also shows quite the urban landscape subject to droughts and water scarcity. I wonder whether there's a differential impact on indigenous populations in the cities. Of course, clustering space, but also the climate impacts. And if you have something to elaborate on that, I would very much appreciate it. Thanks a lot.
Yes, thank you. So the question was about if there are any differential impacts between the impacts of climate change between the rural populations and the urban populations of the indigenous communities. So I will say that yes, and especially because when the communities emigrate to urban places, the access to to services in general, including health services, get a challenge because the urban planning is not something that is a priority still in our countries. So the people can go, and this is a shanty town that that was populated during you probably have been familiar with the Sendero Luminoso, the shanty town that was affecting Peru during the 80s. So at that moment, people from the Quichua lands emigrate to Lima. So this is San Juan de Lurigancho, where the communities just went there, and their studies, for example, showing about how the chronic conditions were more prevalent in these urban places compared with the population who stay in the rural areas. And in these places, for example, access to water is a challenge. So for example, dengue could be a bigger risk compared with maybe populations in the Amazon who traditionally have been exposed to dengue. And also the health services are also constantly fighting against dengue in the Amazon, but not in the coast. So impose a different approach.
Thank you, very interesting.
Thank you.
I
Yes.
was wondering what kind of bridge are needed to build for connect better and create like more resilience in indigenous communities, but also communicate us about resilience. Then, for example, you mentioned mentoring that for people from there, for example, I'm from Colombia, then from people from there mentoring our communities, and then have that bridge, it would be really nice. What other things do you think?
Yes, I think the question, thank you. So the question was if there will be ideas about how we can increase the resilience of indigenous communities by working and connected with other actors. For example, mentoring, where we bridge indigenous and not indigenous in education is a path to increase the resilience. And there are other ideas. For example, we started a small project with the indigenous women who they usually produce potatoes in the Amazon, right? So we started this activity because it's part of their life and we want to connect, and actually we did it. So the women sold the potatoes to the restaurant in Lima, in the capital. So we want, and the restaurant were very aware and very interested in elevate the knowledge about the importance of nutritional value and also the taste of the potatoes in the Amazon, to increase the awareness about the importance of indigenous foods, and especially because these potatoes and the way how they produce it is also resilient to climate change, and also other institutions can investigate, for example, what are the better nutrients or not as good nutrients that you can use this type of nutrients of foods, for example. So there's this called neglected foods, but I say ignored foods that we can also be more aware to connect with this topic. Yes, please.
Thank you for your talk. This seems like a very engaged sort of research, like you've spent a lot of time building your relationship with the communities, etc. My question is that I often work with projects which are very short term, So we don't have a chance to build these strong bonds. Before that, the funding ends and you have to move on. So I was just wondering any recommendations, tips, suggestions on how to work on these sort of short-term projects, but be mindful about the communities, etc., and their needs.
Thank you. So the question is very important because especially when you are doing, so the question was how we can, or what recommendations there are to create this research, especially when the funding or the time that you can spend with the community is short. So how we can improve our impact of improve our work despite of the short of the funding or despite of the short of the time that we are available to share with the community. Well, my recommendation is to join groups that are already on the ground working on topics. So that could mean that our own needs maybe are not going to fit what is on the ground. I can say that in my case, when I went to do my PhD, I switched the topic because the community wanted to work on food security. So they told us that climate change was impacting health through food security, water security, and vector-borne diseases. So I needed to choose. So I chose food security. And because it was a need of the community, we were being able to build up on that because the community keep thinking that that's important. So I think that's the main recommendation, so to work on what the community already identify as a challenge. And what important I think I learned is that maybe 10 years ago, that was important for the parents' food security, but now even after 10 years have passed, now it's still important for the youth, for the next generation. So people will continue concerned about the same research topic. Thank you. Yes, please.
Very interesting talk, by the way. Thank you very much. You're talking about thinking about in the circles in terms of transferring the research and the policy and being back as well in that sense. And the indigenous knowledge from the research as it demonstrates plays a really crucial role in the aspects of being resilient to climate change and keeping the systems resilient to it. But sort of reforms and policies have been most impactful with the integration of indigenous knowledge and indigenous people in terms of building the resilience. Yeah.
Thank you. So the question is to thinking on this connection between research and policy, what type of examples we have where the policies have been more successful in support the resilience of indigenous communities to climate change. So it's actually, this is a very good question. And I think the policies that could support the sovereignty of the indigenous communities where they could decide what would happen with their, I would say, development or their priorities, probably we have the best impact. Actually, I'm just remember about policies that were not so good in terms of, for example, changing the diet. So we wanted to provide food, which is a priority, and that's a right. So to have food, that's a very basic thing. So sometimes the policies can be well-intentioned, but not necessarily are going to have the impact that you expected. And also I'm thinking in the health systems per se. For example, when we are talking about sanitation, we are using chlorine, but the chlorine not necessarily is going to satisfy the taste and the priorities of the community. So we're going also to lose the opportunity. And also the community use different types of water. We don't just drink clean water normally. I see that every of you, and maybe because the weather here is drier than where I live, but for us, it's more like different types of liquids. So we have juices, fermented beverages. So we are not, that's different practice. So I think in terms of policies, we also need to, in Latin America, there are policies about intercultural health, for example, where you need to adapt the health services to receive and to adapt and to respect the cultural practices, like, for example, maternal health. That will be working in Peru, but it's not we didn't analyze it from the climate change angle, for example, but would be interesting to analyze the actually in place policies in healthcare sector to see how are making through the climate change. Thank you. Yes, thank you.
I was wondering what the role you think is how it kind of building resilience.
Sorry, I couldn't listen the first part.
So you kind of mentioned like indigenous like philosophies and reciprocity. And I
Yes.
was kind of wondering what role they have in building climate resilience.
Yes, the question is about indigenous values and principles like reciprocity. What would be the role in climate change resilience for indigenous communities? Well, there's a lot of value, because specifically when they are key moments in the life and extreme events and difficult time, this is when the reciprocity is like a spike. So it's the trigger, the help, for example, to share food, but also when a baby is born, for example, the relatives came and provide food, so the mother stay at the home and also the father stay with the baby. So this reciprocity that we usually are not keeping when you emigrate, for example, because you break the nexus with your community and with your family. So this indigenous value, if we could bring with us to in our moving, I think specifically we're going to face more extreme climatic events, could give us more easily solutions just to help among each other. Thank you. Yes.
Thank you very much for your presenting. It's very, very interesting in your research. So as you're doing your research and doing the field work in the indigenous community, so my question is, what is the power relation that you found doing the field work or doing the research with the indigenous community or with the policymaker?
Thank you for the question. So the question is, well, I was doing my field work, how was the power relationships with the community members and also with the policymakers? Well, actually, I should declare that I felt the power relationship, especially with the policymakers when I was on the ground, even if I was Peruvian. When I was a physician, I was a physician, so everyone called me doctor, right? So my power relationship was more like, okay, so you will provide a service, and I was very conscious that I need to provide the service. But when even if I was in that position, people didn't come to my office. I had to go to, because they have their own indigenous medical system. So I learned that part in that aspect. But then when I wanted to understand better the context and did my PhD, I brought my card, student card, and showed them. I say, I'm not a doctor anymore. I'm a PhD student, so I'm a student. And that broke in some way the power relationship to understand, to them, to understand why I was there. But while I was doing that, I couldn't also approach the health officers because they were the health officers. And for me, they were my boss when I was a physician. So it's like the elite was still present. But when I was wondering and I was realized that this is not going to change, at least I approached the policymakers, and that switched my mind, and I went to approach them and say, well, we have all evidence here. We need to work together. And I was very lucky. And also I think it's the movement about climate change that make all the health officers also aware that this is important. And also the environmental office. I think the movement starts for the environmental sector and then the agricultural sector and the health sector. So now it's more easy to go, and also have more white hair. There is also helping to be listened by the officers. Thank you.
There's a question online that I can read out.
Yes, please.
So thank you for your speech. So what I would like to ask is that what would happen in a scenario where the people do not agree readily with a policy that is good but not readily acceptable to the indigenous people?
Thank you for the question. Yeah, I understand what you are saying. Well, part of work with indigenous people and in general, when we are doing research, we know that time is important, right? So, and also for indigenous people, times is not something that is happening in one year for the next one. So for that cases, I would recommend to keep the negotiation and wait. I have been in cases where communities just simply, they didn't want to be part of my work. And I just accepted. We still are friends, but I cannot do anything with that. I've been in also in positions where a communication system is going to be installed in one community, but at the end, the company says, no, we cannot install the communication system in the community because there are not enough people. We need to put it in the other community. So this community says, that's not fair, because who do the call and who ask for the communication system is us. So I couldn't do anything. So at the end, the company didn't put the communication system. So I've been in situations where also the community told me, we don't want that you communicate these results to the world, because I don't want, my community doesn't want that being recognized for the world. So I cannot do anything. I think it's important, the last part that I say about build trust. So communities has the experiences about why they are asking or rejected an intervention or a policy. So for that, I think negotiation and patience and time, it's important. Yes, James.
So Carol, you do a lot of work at the global level as well.
Yes.
Can you tell us what can we learn from these communities, for say some of the negotiations going on at the COP meeting next month? What's your work tell us we need to be doing at this level?
Yeah, that's important. I think that at the global level, it's important to think that climate changes show us that the impacts are not only at the global. I mean, the impacts are concrete. And the people who are in these communities who didn't really create the crisis are feeling this impact. So I think in the global negotiation, it's important to recognize that we are people. And these people are also part of the negotiation, even if they are not at that level.
Can you elaborate more about indigenous sovereignty, how it will be helpful in policy making and also control over productive resources of the indigenous lands?
Thank you. So the question is about the indigenous sovereignty, right? And how we can understand that in the policy arena. Yeah, I think this is a tricky question. Depends on where you are, because if we are researchers, if I would be an authority, probably my position would be different, because sovereignty means that maybe they're going to reject something that we as authorities thinks that, for example, this is going to increase the vaccination rates. And that's important, right? So as an officer, I will be very upset and frustrated if the community use their sovereignty to say, no, we are not going to accept. As a researcher, I will say there are options, because currently, for example, so I need to respect first. So I need to respect the sovereignty, but also there are options to continue the negotiation and to open windows of work and to understand why are rejected. For example, the Pan American Health Organization are using intercultural knowledge dialogues, where these are not only conversations, these are spaces where these type of disagreements can be understood and support an actual agreement. So I think we need to respect the sovereignty, but still I understand that there are spaces where we can understand each other better, like using these methodologies. Thank you.
Ask one more question.
Yes.
So you're involved with the GEO7 assessment of the Indigenous Knowledge Task Force. Just give us some of the reflections that you've had from that process in terms of some of the opportunities and challenges to get Indigenous knowledge in these global assessments, quite similar like IPCC.
Yeah, so first, I will recognize that 10 years ago, it didn't exist. I mean, there's a progress. And second, I think I felt that there is a fast, like climate change is coming, is changing fast. I think also the attitude of of science, the science community in general, to be more open to the value, to the recognition of indigenous knowledge, because we that work as a scientist with the indigenous community needs to produce tangible results about what this observation or what this value, what is the importance. I feel also that we are in a journey where we are going to produce, and I understand what indigenous leaders says, why we need to prove that our knowledge is valuable. And right, so this is why we need to prove to you that the knowledge is really, really valuable, because they survive, they resist, they are still here, and we are struggling. If I change my position, we are struggling with climate crisis, and they are still surviving. They can survive without us, right? In some way, right? And so I will say that the GEO7 is teaching me the importance of that, the importance of understand these power imbalances that are between the local and the global. And this is why I wanted to present this more about what is happening on the ground. So the scientists who cannot have the lived experience of going the ground can understand the importance of bringing this knowledge to the projections and also to the policies. Okay, James. Yeah, first and second. Yes, thank you.
Yeah, just you as a medical professional, before you put the student sign out, what did you learn from these indigenous people about health? What like herbal things or things did you learn in this journey yourself? What did they that you can bring back to being a medical doctor, and not have you been revealed some secrets of wonderful things that grow there that help
Yeah.
people that aren't indigenous, perhaps?
Yes. So the question is just to ask about as a medical person, as a medical doctor, what I have learned from their medical practices that I can bring to my own practice as a physician. Well, I will say that there are practices related with promotion, prevention, for example, that using the public health language, right? So prevention, promotion, because since a baby is born, they are like celebrations, they are rituals that all the family is going to celebrate and aspire that the baby will live forever. So there's like this feeling, this connection with health, that's related with rituals in different parts of different moments of the lives, childbirth, first menstruation, for example, with women, also when someone passes away. So there are moments in the life. So that's one aspect, the promotion, prevention of be conscious about health. The other part is plants and practice. So plants like specific material. So these three words for pain, these specific herb words for menstrual pain. This is for snake bite. This is for leishmania, for Huta. So there are different specifics. So there are like a more prevention, promotion, but also practical things that I have learned. And I also recognize that this is not something that's going to tell me easily. I remember what my mother told me about plants at home, but when I am working with indigenous community, it's a different space. So for them is, as I am telling you, telling James before, this is normal. So I'm not going to tell you how you turn on your screen, because this is something that everyone knows. So this is not something that you're going to ask, how do you cure a diarrhea? So it's not going to emerge in that aspect. But definitely, I feel that I'm getting more like a woman, indigenous medical people than a biomedical. Yeah, definitely. Thank you for the question. Yes.
Just maybe a bit more on the personal experience. Is that first thing that you sort of stand put in a position of being like an outsider towards this community, and then you sort of the transition towards becoming more of an insider, part of it. How did you sort of overcome in yourself like the challenges of actually becoming more, having that sense of being part of the community rather than being seen as the outsider, And how do you feel that sort of has translated into not just listening to the communities, but also making an important part recognized in research as well as in policies?
Okay, so the question is about this transition between being an outsider and an insider, and how I was navigating that to translate in research and policy. I think this is very important because when I was an insider, I felt more the pain in some way because I'm living with them. I remember my own family. So both of my grandmothers, they died because of diabetes. So diabetes is part of my story. And so when I am insider, I recognize the outcomes, I recognize the impacts of climate change is having on the crops of my friends. But when I am an outsider, I felt like the strength for the advocacy part. I say, this is not fair. This is not just. So we need to make a change for that. So we need to stop it. So as an outsider, I say, let's design a study to understand that better, to elaborate on what type of policy we can promote. But that I think came from an outsider mind compared with my insider mind. That's how I'm trying to balance the craziness. Thank you. Yes, yeah, and then you.
Thank you. Apologies, it's a little ill-formed, my question, but thinking about what other people have said and the idea of Indigenous communities, I'm wondering to what extent if you've observed over time the multiplicity of issues that communities face coupled with, say, migration, is that having any impact on the ability to make cohesive decisions amongst the community and sort of that sovereignty question? If there's sort of a traditional process through which a community makes a decision, but again, because there's all these convergences, that decision-making process is changing.
Yeah, the question is very interesting because it's related with governance of the communities, right? So the question is how all these processes are changing the cohesive of the community and the ability to take decisions, especially when we are talking about sovereignty, for example. And yes, I think this migration process, in some way, Indigenous organizations, for example, is a response to that aspect, because Indigenous organizations, they try to work with the communities, with the leaders, even if they are not living. I mean, the leaders are in the communities, but the Indigenous leaders at the regional and national level, they are in different places. So maybe that's the way how sovereignty is also implemented through this organization, because I see what you mean. When you list your community, you cut the nexus, and normally you have like a chief or an apu or a curaka in the community, but when you are in the shanty town, and actually when my family came to Chimbote, where I grew up, they also self-organized as a community to build things that we needed with sanitation and things like that. But I think probably Indigenous organizations are one of the ways. Thank you. Yes, please.
So I was wondering whether you had observing any kind of health implications or impacts from climate change among indigenous communities, and that if yes, what kind of approach you adopting to help?
Yes, this is very important question, because with climate change, we are seeing the impacts in the literature in general. We can see that people who are exposed to floodings more frequently has more like post-traumatic events, post-traumatic experience. So there are serious implications, clinical implications with climate change in general. With Indigenous communities, it's similar, but what we're doing in Peru is that, for example, in the studies that we are doing about healthcare system resilience, the person who are in charge of mental health is part of the team. So we are communicating with them about the results of the study. And even if we are not looking specifically at mental health outcomes, I think bringing aboard the people who are caring for the mental health is important to respond. And I think that's also related with, in general, the mental health of the population, the Indigenous populations, independently of climate change. I think climate change is something that, as in many other examples, is going to amplify what is already on the ground.
One more question for this one.
Yes.
Any more questions?
What about the glaciers?
Mhm.
What's the long-term impact on the health of the urban population, especially the indigenous? Because it intersects, it's like adds to the shock of trends that we are seeing.
The glaciers, right?
Yeah, they
Yes.
are melting, and there's going to be like one water source less.
Yes, exactly. Well, the question is about the melting of the glaciers in the Andes in general in South America. Well, many of these mountains in the case of Peru, for example, there's one mountain that that feed the water in Lima, in the capital, right? So I think people who are the authorities and who live there should be very, very concerned about the consequences. And in the case of Bolivia, for example, I saw that the people, so the glaciers are melting and also the droughts are getting more extensive. And so we are having extensive droughts recently. And the consequences are also related with the impose of, for example, wildfires. But also in the dry conditions, the wildfire are getting more, the risk increase, and also the pollution is worse. So there are many cascades effects if we think in the glacier melters, and it's connected with water security, but also with other practices like agriculture, for example, and also even economic activities that are prevalent like mining, because also depends on those waters. So there are many. I didn't revise much more honestly the consequence if there's literature, but I imagine there is, but also there is a need to understand better those aspects. Yeah.
Thanks, Carol.
Thank you, James. Thank you very much.
Thanks, Carol, for that really inspirational talk. And Carol, she's in Leeds tomorrow, and then on Saturday she heads to Rome for it's the annual meeting of the UN's Food and Agricultural Organization, their global hub on indigenous food systems. So Carol will be going to Rome next, and that's why she's timed her trip around that. So we're minimizing the air miles of her flying. But anyway, we've got refreshments now. So if you've got any questions or just want to chat to Carol, please come along. I'd like to thank you all for coming. Got a really great turnout here in person and also online as well. Thanks, everyone. And yeah, thanks, Carol.
Thank you.